Hello everyone, I'm Dr. Darsh Shah.
And I'm Dr. Altamash Raja.
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare. Marcus Aurelius once said, "If you are distressed by anything external, the pain is not due to the thing itself, but to your own estimate of it. And this you have the power to revoke at any moment." Well, our guest today is none other than Dr. Robyn Tiger. Now, Dr. Tiger is on a mission to empower physicians with self-care tools backed by science and research. With physician burnout and mental health issues on the rise, Robyn knows firsthand what it's like to love your job while also coping with stress, anxiety, overwhelm, imbalance, and even illness. She uniquely combines her 15 years in diagnostic radiology with a certification in yoga therapy, meditation, and life coaching in her innovative CME accredited courses, private coaching, and podcast called the StressFreeMD podcast. She is deeply passionate about helping her colleagues relieve stress, elevate calm, and live their best lives. So in today's episode, we asked Dr. Tiger what the impetus was for her to start her own coaching business. Now, she has an amazing journey. She really talks about how she got overwhelmed with a lot of these burnout symptoms. We then talk about why the Great Resignation is even happening, which essentially 20% of healthcare workers are leaving the field. We then talk about how we as humans can find more purpose in our jobs and what it means to truly be stress-free. And lastly, we also talk about how we gain comfortability in reaching out for help whenever we truly need it. Enjoy the show.
Robyn, welcome to the show.
Thank you. I really, really love your podcast, and it's an honor to be here.
Oh, the pleasure is all ours. Today, we're going to dive into stress. And I don't think that one podcast is going to be able to cover the ridiculously large topic of stress. And I think that most people, when they think stress, they're thinking negative stress. And of course, I want to talk about all aspects of, there's positive stress, negative stress, and all those things. And you're the StressFreeMD. So you're the expert, and you have an extremely unique and special journey that got you to be the StressFreeMD. And so before we talk about different ways to cope with stress and all the things that come with that, I'd love for you to share your journey with the listeners. And how did you get here to be the StressFreeMD?
Yeah, well, let's see. How far back do you want me to go? Because third grade.
All the way back. Yeah, third grade.
Third grade. I knew I wanted to be a doctor, right? That's when it started. My teacher, Mrs. Miller, she rolled out this life-size skeleton, and I thought, okay, this is not just a Halloween decoration. This isn't a Halloween costume. And I learned that was actually inside our bodies. And I said, wow, I need to learn more about this. And that was when I wanted to become a doctor. So this began when I was, 7 or 8 years old. And fast forward, that's what I did. I went through all the schooling, got to med school, went through med school, internship in internal medicine, did a residency in radiology and a fellowship in body imaging. And then I went into practice as a diagnostic radiologist. And I still think that being a physician is the greatest privilege ever. But to be completely honest, I changed a lot during that journey. And at some point during, I was maybe 10 years into practice, I started to really, really lose myself. And I just noticed that I was having many different types of illnesses and symptoms that none of our colleagues could put together. Things like migraine headaches with this intractable vomiting. It prevented us from going on a Disney trip, had us in the wrong line at the airlines for some Jamaica trip because I had no focus and concentration. I had vertigo that was really, really disorienting. I had bleeding gums. What does that have to do with anything, right? As putting all this together, pain throughout my body, felt like the Tin Man. I would wake up in the morning and it felt like that Tin Man from the Wizard of Oz. I couldn't move. Really, really horrible gastroesophageal reflux. Couldn't sleep. And an incredibly scary thing that was happening was that I would get these paresthesias in my hands, my feet, and like the left side of my back, where I swore I had this debilitating neurologic disease. I couldn't cut up vegetables, making a salad. I had trouble pulling the trigger on the biopsy gun when I'm doing like a breast biopsy. I'd be driving and I couldn't feel the steering wheel. I mean, these strange paresthesias were just like, come on, the most inopportune times. Not that there was ever an opportune time. And it was just me circling the drain. I started to have really bad thoughts that I didn't want to be here, thoughts. Like I didn't actually imagine hurting myself, but I thought to myself, I don't really know if I even want to be here anymore. Like this is just so painful. This is so horrible to live like this every single day. And I just didn't feel worthy at work. I didn't feel respected. Hard to get up every day, bring myself into work. And so that is my rock bottom. You know, all of these physical ailments, went to see lots of docs, took a lot of pills, had lots of imaging studies, went to a mental health care professional, wasn't getting better. So me at the bottom and thinking, maybe it's better not to be here. So that's the beginning of the next chapter.
Wow. That is extremely powerful. And I want to thank you for sharing that. Right. And I know that you had several colleagues who maybe weren't allowed. You talked about this previously to see the next chapter. And I'm glad that you are. And so you can share your journey. And if you want, I'd love it for you to shed light on that too. But
yeah,
as a radiologist, right, I've done a couple of radiology rotations and it's fascinating how brilliant they are, right? Because you guys have to know the differential for literally every single thing. So I'm wondering, you mentioned a variety of symptoms and they kind of span different systems of the body, right? What was kind of that conversation in your head when you started having these symptoms that seemingly are not related, but now you know that they are? What was kind of like the differential? Like, what's going on? What was the conversation in your head?
Right. Well, the periodontist thought I had like infections in my gums. So I was getting antibiotics shot into my mouth like every week. The neurologist had me on gabapentin and was having like MRI examinations of like my spine and everything you can imagine. The orthopedic surgeon thought there were issues going on with my hips and my knees, and I was getting MRIs of those, x-rays of those areas of my body. The psychologist thought, I was depressed or I just had, work-life balance issues, tried all kinds of talk therapy, EMDR, this, where they give you the vibrating units in your hands and you talk about your issues. Basically, I was a complex case. And the gastroenterologist had me on, of course, all kinds of meds for reflux. And I think as physicians, we love complex cases, right? Because we want to figure out really, really hard things because that's what our left brain loves to do. But we don't ever want to be a complex case.
No.
And so that's what I started to see myself as. Every physician had me compartmentalized in their specific area of specialty and was treating that particular symptom with a specific drug or therapy, but nobody was actually seeing the entire picture.
Yeah.
Does that make sense?
Yeah, no, absolutely. I mean, that's the difficult part, right? I mean, I think that for lack of a better word, holistic is kind of what we're talking about. And I don't really love that word because I think that word is often just thrown around and people aren't really using that approach in the sense that it's meant to be. And, in medical school, depending on which school you go to, it's a systems-based approach and you do system by system by system. And really, you really got to take, you can have the 10,000 foot view, you can have a 30,000 foot view, but for you, I don't know, maybe you needed a 100,000 foot view. Who ultimately came to see that? Was it you? Was it a provider? Your husband is also a physician, a radiologist, if I'm not mistaken.
Yeah.
Did he have an input onto this? What was the experience like for him? And what insight did he provide?
So he didn't really know the extreme situation that I was experiencing because most of it was internalized. He knew that I was going to see this doc and that doc, and I really kept a completely different armor and a completely different appearance on the outside. People didn't know that my outsides didn't match my insides. And I think that he always likes to look at the world through rose-colored glasses, which is one of the reasons why I also love him so much. But I don't think that he understood the extreme. As a matter of fact, it wasn't until I developed the practice that I have now, and he started hearing me talk just like I'm talking to you, that he really said, wow, so did my family. Wow, we didn't know that you were suffering like that. So I kind of hid a lot of it pretty well. He knew some of it, but not all of it.
Yeah. I often, my wife is also a resident, right? And we often talk about, you still go through these struggles, whether it's through training, and, we still as physicians, we're people too, right? And our patients, they're coming to us in pain, or whatever their chief complaint is, whatever struggle that they're going through. And of course they have to voice it. And it's very challenging when you're going through that. I'll use the word trauma because I think it's somewhat appropriate to describe kind of what you're mentioning. Whether it's internal, external, whatever it might be. And something I always tell to my wife is I just say, hey, the show must go on, right? I mean, you have to be there. Of course, you have to be the best version of yourself for your patients, but it's hard, right? You've got a really cool story where you're doing a biopsy and, you get these paresthesias and you just kind of pause and deflect and the text there and trying to figure out what the heck is going on with Dr. Tiger right now. You want to share that story? I think that's really interesting and give some perspective.
Yeah. So as I mentioned, I'd have paresthesias, areas of times I have numbness and tingling in my hands, my feet, my back, in case we have any non-medical people listening, just areas of times I have numbness where I just couldn't really feel my hands. And as I mentioned, it would come up at very inopportune times, and particularly when I'm in the middle of a breast biopsy, for example, which is something that I did quite often. And the biopsy gun has a trigger that you pull, and you put the tip of the needle exactly where you want it to be. And usually I'm pretty quick and pretty good. I actually, in my fellowship at Jefferson, they called me BTI, which was born to intervene, because they said I was the best fellow, which I'm serious. I'm not one to compliment myself, but my program director said, you're the best fellow we've ever had. And he called me BTI, born to intervene. So for me to be in the middle of a biopsy and to be taking a really long time didn't make sense, particularly when the tip of the needle was right where it needed to be. And my tech would say, like, hey, Dr. Tiger, you're right there, kind of like looking at me like, did you fall asleep? Or, what are you doing? Pull the trigger. And I would just have to wait until that numbness passed so I could feel my hands again and actually complete the procedure. So that's an example when it came to actually caring for patients where this was a very, very big problem, a big hazard, a big obstacle in my ability to practice.
Yeah, Dr. Tiger, I think you said some key words there when physicians think about, stress and burnout and what we're going through. And that was, didn't make sense. I remember probably exactly a year ago being an intern on the medicine floors with, a somewhat difficult team to work with, and winter, cold days, dark days, and not realizing why I felt almost kind of depressed, anxious, panicky a little bit. Really bad mood, and I realized, hey, my wife wasn't here. She was actually back up at home in Boston and kind of going through it on my own. And you don't realize you're in burnout until you're in it, right? And I think a lot of us physicians also don't think we're ever going to reach burnout, especially in today's age where there's so many signs and symptoms, and we've made restrictions on work hours and stuff. It's easier for us to tell. But back when you were training, at what point did you realize that all the symptoms that you were going through were essentially burnout and stress?
Yeah, so we didn't really have the word burnout in our vocabulary then. And I didn't have anyone to talk to about it because nobody else was talking about it. I was like carrying essentially this invisible backpack of pain around with me, right? Like nobody could see. I was putting on a good face for my husband, my amazing little kids, everybody I worked with, my patients. So for me, it was just like this sort of bag of symptoms, right? That they didn't seem to connect, right? That complex case. And I decided I don't want to take all the pills anymore. And I didn't want to just go to the mental health care professional, although they are excellent when they are doing their job. But for me, it just wasn't working. And I started to look outside the box of traditional medicine,
Mhm.
saying, okay, I believe in Western medicine completely 100%, but it's failing me right now.
Sure.
Right. So, as you mentioned, I had 3 colleagues that died from suicide. At that point, I think I had lost 2 of the 3. 2 physicians that I thought were perfectly
Mhm.
fine. I only knew on the outside that they looked completely normal, completely fine, completely happy. One was a resident with me. She was a medical student and a resident with me. And she was kind of like my big sister. She was the one, we didn't have packs at the time. We had actual film. She would come in the middle of the night and go over cases with me. She actually wanted to follow my footsteps and do the fellowship that I was doing at Jefferson. So she called me and she said, hey, I did this interventional fellowship. I'm in practice. I'm not loving it. Can you get permission for me to shadow you for, a day or 2 or a week or whatever, so I can see if I like what you're doing and maybe I'll come and do your fellowship. I got permission. I was excited she was coming. And then 2 weeks later, she overdosed.
Sure.
So that was just like, you know. And then there was this amazing human who was an attending in the practice where I was working, my first practice, who was the only doctor that always checked in to see how I was doing. He called me when I came back the very first day after having my daughter, checking in how I was doing. Just this happiest, kindest, nicest man. And he overdosed. Right. So 2 examples of people, who look completely different on the outside than the inside. So I was scared. And so that brings me to me looking outside the box of medicine. And I started hearing about all kinds of things like yoga, things like meditation, things that I never ever considered in my life because I thought they were kind of like eye roll worthy.
Yeah.
I was training for races and at the gym all the time. I'm a gym rat, still am. And I just didn't see myself in twisty things, turning upside down, saying weird sounds. I had all these completely wrong preconceived notions. And so to answer your question, how did I know that I was experiencing stress and burnout is that I put myself into a yoga class, a meditation class for the first time.
Mhm.
Grabbed my neighbor, she's a nurse. She came with me. She gave me the eye roll. We went in. And I have to tell you that after the first class, there was this incredible shift, right? I felt calm. I had clarity. I was not tired after working a very long day and taking care of my kids and rushing to get to this class. I felt amazing. And so that was my first
Mhm.
inclination into, all right, what's the physiology here? Okay, because my left brain saying, what just happened? And that was my very first inkling into, okay, the pills didn't work, the talk therapy didn't work, but I'm feeling better right now. There's something physiologic going on. So that was my first inkling into let's go back to what we learned in med school with respect to our nervous system and see if I can figure this out.
Yeah, absolutely.
That's what I did.
Absolutely. Thank you so much for sharing that, by the way. I mean, I'm sorry to hear about those losses, and it's so often that it's people that we least expect, right? For these tragic events to happen to. And oftentimes these stories are short-lived in the medical community, but they leave a lasting impact, right, to those who really feel that deeply and personally. And obviously, you're one of those people, and you've taken action because of that. And you've found a higher truth, if I can say, when it comes to burnout and stress. I want to touch on your yoga certification as well, but before we do you think it's worth kind
Mhm.
of just breaking down terminology within burnout, kind of some of the components that lead to stress and burnout? So if we could kind of just go over compassion fatigue and moral injury and what stress is.
Yeah. So, well, first of all, there's good
Mhm.
stress, right? There's stress that is okay, right? Because we need a certain amount of stress, okay? Because that's what keeps us going. That can make us get a task done. That can help propel us. There's a stress of coming on this podcast, but it's a good
Mhm.
stress. It's a happy stress. I can't wait to talk to you. Stress, and then there's distress, right? Stress that's not a good stress. And when we talk about that, we most commonly talk about chronic stress. And that means the chronic stress response is on overdrive. So we've got our autonomic nervous system composed of our parasympathetic and sympathetic nervous system, but our sympathetic nervous system is always on, even when it doesn't need to.
Mhm.
So that's the stress that we're talking about that's causing us to feel all of these feelings and experience everything we're experiencing negatively. With respect to burnout, burnout has been categorized with respect to three main components. Okay, so the first component that's talked about is emotional exhaustion. And the second component is cynicism. That's like
Hmm.
having a negative attitude. Like, even if you have been the nicest, kindest person that your patients love, you can't even like listen to another word they have to say. You just don't have any more tolerance. You just have this bad attitude. The third is this lack of self-worth. And so burnout has been defined as these three components. For me, you asked who, was able to make that diagnosis, and it was me.
Mhm.
So I was the only physician that was actually able to correctly diagnose my illnesses and my symptoms. And the diagnosis was a whopping case of chronic stress, which led to burnout. But it was actually my own physiology, my own stress response on overdrive that was causing all of these symptoms that I was having.
Yeah, absolutely. I think all those terms are definitely important to learn about, right? And I think as trainees, we learn about burnout, but we don't understand how much of it is at a personal level, right? I think too often we think it's
Mhm.
something external happening to us, and we don't get the
Right.
chance to kind of debrief what happened. I mean, I remember last year really not taking the time as I was going through burnout until that period was over, right? I had to go through a hump and get to an easier rotation, and then look back and say, "Whoa, what the heck just happened? Who was I? What was going on? And what could one I have done better? Could I have reached out to people?" So yeah, I mean, it's a whirlwind of a process. So thank you for going through those.
Yeah, and what I'll add to that is, you did a great job kind of highlighting the different steps that they go through, right? And one of the things that we've talked about time and time again on this show is this concept of listening, right? Therapeutic listening in particular, my co-fellow and I talk about. And, when you go through that cynicism stage that you mentioned, and it's so hard to just hear another word. Darsh and I, we're physiatrists by training. I do sports medicine, and majority of my practice now is people coming with pain of some sort, right? And pain is a ridiculously complex topic, as we all know, and we're learning more and more about that today. What we do know, though, that listening to our patients, their concerns, their pains, their anxiety, what their perception of pain is, and understanding that is no question, it's helpful, right? I don't think it's the treatment or a cure. I mean, well, I shouldn't say the cure, but it definitely is part of the treatment, right? When you're in that stage, though, that's cynical stage, and you don't see a biomechanical cause, something you can't inject, something you can't operate on, something like that. It's very hard to do, right? And I know these things, but depending on what my distress level is, I should say, it can be very challenging to do, right? And so I think that this is probably a great time to dive into some of the strategies that we can use, healthcare practitioners can use, but even those who are not in the healthcare field can use. So you mentioned yoga, right? You mentioned breath work. You mentioned some of these things that really were, for lack of a better word, like revolutionary for you, right? Talk a little bit about that, wherever you want to start with the strategies.
Yeah. So, first of all, the preconceived notions. Okay. Lots of spandex.
Mhm.
People twisting their bodies into strange shapes that, as a radiologist, I didn't think that was even possible or they should be doing. Okay. What else can I debunk here? Weird music, weird language, all kinds of things. Um, I had all those thoughts. So if you're thinking all those thoughts, I had them. The thoughts that you have to spend an hour and a half doing this stuff, the fact that you have to be flexible, um, all these kinds of things. So my story began, like I said, with my very first class. And when I started to see that shift, my doctor brain went into the physiology And over time, as my symptoms started to get better, because that's how I knew what was I experiencing, I dove deeper and deeper. And I think Darsh asked earlier about the different types of yoga certifications. So just to understand, a base level yoga teacher needs 200 hours, and a yoga therapist is at least 1,000 hours over a 3-year period. And so the doctor in me, once I heard about this field of yoga therapy, which would enable me to take the base level education of yoga and apply it to help individuals with many types of illnesses, symptoms, and diseases, I dove right in. And it was my own personal transformation that I was after, and my own personal healing, as well as, wow, I can help so many people on a much deeper level. So it isn't the yoga class, but it was studying yoga more deeply for many, many years as a yoga therapist and becoming certified in that. And then becoming certified in a few other things, such as meditation, but specifically eye rest, which, ultimately you're talking about pain. And this is a really interesting, topic, because this meditation was originally created for Walter Reed Army Hospital to help our military relieve their suffering from PTSD. And I was looking for a very secular, very evidence-based meditation. And it was found to be so helpful not only for that, but for chronic pain, that in 2010, the Department of Defense declared this meditation a Tier 1 treatment for chronic pain. And that's because so much of our pain comes from our stress and our thoughts, because that's causing so much tension and so much inflammation, everything else in our body. So many of the patients that are coming to you don't have a mechanical issue. You talking to them makes them feel better because they're starting to relieve their stress, right? So sometimes they need you to do something, but other times they don't need you to do something other than just listen, just talk to them or give them some tools. So the first component was the yoga therapy, which we can dive into a little bit more. The second component was the specific type of meditation that was very, very clear to me that I needed to learn, because I wanted to be very, very neutral and very safe in what I was offering, and I wanted to be very evidence-based. And if it's working for our military, wow, I wanted to learn that. And then life coaching, because life coaching helps us work with our thoughts. So up to that point, I've been doing a lot of work with working with the body, the physiology, managing the nervous system, creating homeostasis between stress and relaxation responses, but then working with our thoughts. Our thoughts, 60,000 of them a day, which most of them are not so nice, learning how to work with them, right? So those are the 3 main components that I love to share and that I teach and I educate on.
Let's do that. I'd love for you to start with the meditation piece of it, right? We've definitely covered this topic, maybe not super deep, but we definitely had I guess previously, I forget what podcast, which episode it was, but we'll link it in the show notes for you. But maybe also if you could just touch on the difference between meditation and mindfulness for people, because sometimes they confuse the two. And then we can go into the yoga, and then of course life coaching.
Sure. So mindfulness, to make it really simple, is paying attention on purpose. Paying attention on purpose. So one of the lectures I just gave one this weekend actually. Imagine an image, a cartoon of an adult with a thought bubble filled with a gazillion things. Okay? And then holding hands with a child with a thought bubble that has a picture of a sun and a few flowers. And the picture behind them is actually they're walking outside and there's a sun and a few flowers. So mindfulness is paying attention on purpose. The child is seeing the sun and the flowers, and the adult is seeing everything but that. Every single thought you can imagine is in this guy's thought bubble. So mindfulness is when you're actually present and you're aware what's in front of you, what's around you, what's going on inside of you, and you're intentionally paying attention on purpose, which most of the time we're living from our shoulders up in our brain, 60,000 thoughts per day, and we're completely disembodied and we have no idea what's going on around us. Bumping into things, forgetting things, don't know why you came in this room, that room, why is my toe hurt? I don't know, whatever, right? So that's a really simple way to explain mindfulness. Now, meditation is really the umbrella under which many different types of flavors of thought work, of I should say there's many types of meditation, right? There's many flavors, just like there's many flavors of ice cream. Mindfulness is a form of meditation. It's a form of many meditations, and you can bring it into many meditations. So it's really the umbrella under which mindfulness will live, if that makes sense.
Could you give some examples of different types of meditation, right? I mean, I think most
Mhm.
people think of just anchoring with the breath, right? That's one. But what
Mhm.
other types that people might not be familiar with?
Yeah, so I mentioned I rest. Let's start with that. Little I, big R. I rest like the iPhone. And initially, when it was created for Walter Reed, the my mentor actually went in and they said, you can't call it anything like meditation or anything at all because they won't do it. You have to call it something that sounds like they're going to want to do it. And who doesn't want to rest, right? So that is the meditation that I facilitate, that I'm certified to teach. And it was an over 3 year certification to really learn how to do that and become certified in that. That is predominantly guided. And what I mean is there's meditation where you're totally quiet and you're just with yourself, or there's meditation where someone's talking to you and talking you through it. And most people think you have to be quiet, and there's no way I could do that because I have all these thoughts. I can't quiet my mind. There's no way I can do that ever. I'm never even trying. That's what I frequently get from, particularly from very, very busy doctors. So I like to break meditation down into guided and not guided. Okay, guided is someone's talking to you. Not guided is you have other things going on. You're not being spoken to. You're either sitting quietly. You mentioned following your breath. You can listen to music. You can also do things like you're eating. There's an eating meditation. Actually, I have an episode of this on my podcast where have you ever eaten an energy bar and you go to take another bite and it's gone?
Every day.
Or you
All
go
the
to take
time.
another, all right, all the time, right? You go to take a chip out of the chip bag and you're like, wait, where do they go?
Yep.
Okay. I call that empty wrapper syndrome.
Mm.
And I actually did a whole podcast on that. So we can eat and meditatively eat, even if you're in between patients, really paying attention on purpose, being mindful while you're eating, tasting your food, feeling the textures in your mouth, smelling it, all of that, feeling it in your hands. You can do a walking meditation where you're outside and you're listening to all the sounds and everything you're seeing and the smells and the tastes and hearing the crunchy leaves under your feet. So, meditation is really anytime you're paying attention to someone speaking to you, your own senses, anything that's outside the 60,000 thoughts that are going on in your brain. And that's how I like to think about it.
Dr. Tiger, when you talk about meditation with your clients, obviously it's a process, right? You're not going to find results happen overnight. What do you tell them to expect as they go through the journey?
Well, because most of my clients are doctors, and most of the doctors are not going to sit quietly. A lot of that is the I don't sit quietly, by the way. I don't like to sit quietly. That's really hard for me. I like to have either music or listening to a recording, and that's okay. There's no ego involved here. Just the fact that you're giving yourself time to be with yourself, even if it's 5 minutes, is amazing. So the meditations that I facilitate are all guided for my docs. I have a morning meditation where I'm talking and I'm giving them something to think about, an affirmation, something to think about for the day, talking to them the whole time. I have meditations, like mentioned, I rest, where I'm speaking and I'm guiding them through everything. And those are the two main meditations that I work with physicians because they just want to hear me talk and they don't want to think about it. Okay. And so they get results because they don't have to think about it. And once they come out of their thinking mind and they're just listening to me, within a week, no joke, they have a shift. So it doesn't have to be hard. It shouldn't be hard. It should be easy. So I make it really easy. Yeah.
A week is pretty impressive. Is that every single day, 7 days, like a daily practice?
So I recommend that you give yourself some time in the morning to sit and to just be with yourself. Because most of the time we wake up and we're super stressed and jittery and we're out of sorts. I don't know anybody that wakes up super calm and super happy and completely ready for the day. And if you are that person, I want to know what you're doing, because every single one of us they have thoughts, we have stuff going on. We wake up, that's just how it is. We're not in vacation mode, right? We wake up and life is happening. So I do recommend that. Now, I don't ever say you have to, right? I don't say you have to do anything. It's really invitation and choice, which is how I share and I educate. And if docs tell me they have 5 minutes, I say, okay, 5 minutes. You're going to give yourself 5 minutes. That's it. You got 15 minutes, 15 minutes. But I do recommend giving yourself even a couple minutes in the morning to transition between waking up and starting your day. And just that alone is an incredible shift. So yeah. There's no recipe in 7 days you will. I mean, it's not like that. But I can promise you that as soon as you start to balance your autonomic nervous system, you will feel better.
Awesome. On that note, I would love to kind of go a little bit further into the physiology. All right. We can talk about the nervous system and what's happening. I mean, I know that we're not just for our left brain, right? If we could zoom in a little bit and talk about, essentially what breath work and this kind of stuff is doing both for the central nervous system.
Okay. So with respect to breathing, as docs, let's go back to our physiology. So there are 2 key physiologic points with respect to breath. And we learn a lot of physiology in medical school, but we're just not really taught that we can actually work with that physiology. So with respect to our breath and breathing, our physiology teaches us that when we inhale, our heart rate increases, and when we exhale, our heart rate decreases, right? So when we want to feel calmer, we want to focus on our exhale breath. Our exhale breath is the key to our relaxation response. That's the key to the calming part of our nervous system. So take a deep breath doesn't work because you take a deep breath and that's very stimulating. And all your breath is up here in your chest. It's actually your exhale breath. So the first physiologic point is we want to make that exhale breath as long as we can within our comfort level, not forcing it, but just inviting a long exhale. That decreases our heart rate, decreases our blood pressure, and that's the parasympathetic component of our breath. Sympathetic component, inhale, parasympathetic component, exhale. The second part is where your breath is in your body. So our vagus nerve is the longest cranial nerve, starts in our brain, goes all through our body and into our abdomen. And it's Latin for wanderer, right? So it means wander. It's this really long wandering nerve. And so the location of our breath is very important. When we breathe into our abdomen, we're increasing vagal tone. The vagus nerve is the key nerve involved in our parasympathetic nervous system and our relaxation response. So when we breathe into our abdomen, we're tapping into that vagus nerve. We're decreasing our stress response and increasing our relaxation response, and we're feeling calmer. Chest breathing is stressful breathing. Abdominal breathing is calming breathing. Stressful breathing is sympathetic nervous system in the chest. Abdominal breathing is parasympathetic nervous system. So those are the 2 key physiologic points. Now, we kind of learn this physiology in a roundabout way, but when you break it down like that, it makes it so easy to understand that if we simply lengthen our exhale and invite our breath deeper into our body, we're going to feel calmer. And there are many different ways to breathe that incorporate one or both of those categories of physiology. So that's the left brain answer to your breathing.
I love that, Dr. Tiger.
So
Go for it. Yeah.
Oh, good. Okay. Let's see. With meditation, neuroplasticity gets me super excited because as a radiologist, I love to see those MRI images. And, when people said, oh, that's weird, doesn't do anything, the MRI images are amazing. When I got to see live, Mass General, Harvard researchers lecture on this and show before and after MRI images, I was blown away. And what happens is, what they found with meditation is that we have some incredible neuroplasticity happening. And way back when I was practicing and learning to be a radiologist, I was told that we can look at the gyral sulc pattern on CT and MRI to determine how old someone is. So the sulci are the the crevices, right, in between the gyri, which are the tissue. And the pattern changes as you get older. We get deeper sulci and we get smaller gyri, right? And we could actually look at an image and say, okay, that person should be this age. But when someone meditates, all bets are off. And that's because the brain actually gets younger. The prefrontal cortex thickens. So that's our CEO of our brain. That's our decision-making center. That's our critical thinking. So the prefrontal cortex gets thicker. Like, who doesn't want that, right? Mm-hmm. And our amygdala gets smaller. That's our trauma center. That's where our anxiety is. That's where our stress is. And that's where all of our previous memories of bad things are living. And our hippocampus gets thicker. And that's where new memories are stored. Mm-hmm. So this incredible neuroplasticity is happening when people meditate. And so that, to me, again, left brain wants to see it, wants to know it, and that is pretty amazing. So if you have any question, go to that neuroplasticity. and then, with respect to movement, right? So stretching, right? People think stretching, what happens? So if I'm looking at both of you, no one else can see you but me, but I see some shoulders forward, right? So if I tell you to sit up and bring your shoulders back, do that for me. Okay. And then just soften again and just come back to, right. So you come back to where you were. So for everyone else listening, they brought their shoulders back, and then when they relaxed, they came forward again. And that's because stretching doesn't work. Stretching doesn't change us permanently because it's a spinal cord reflex. So the physiology of muscular movement is when we stretch a muscle, it's a spinal cord reflex. The mechanoreceptors send a signal to our spinal cord saying, muscle stretched. Spinal cord sends a signal back to the muscle saying, recontract. I mean, you know this from your background in, you're both in sports medicine and physiatry and whatnot, right? So I'm not telling you anything you don't know, but think about it this way. Why do we keep stretching if it's not working, right? It makes us feel good temporarily, but does it permanently improve your posture? Does it change the shape of your body? No, we just go back to where we were. So moving in a different way that I learned, in a somatic-based way, is using eccentric contraction, called pentaculation, and interoception. So when we contract into chronically tight muscles and slowly release them, over time, they will lengthen. And they lengthen when we bring our brain involved and we allow for interoception, or that sensation. So we contract into a tense muscle, we sense it, and we slowly release it, which is the opposite of stretching. And we bring in the brain because we're sensing what we're doing. Over time, chronically tight muscles will lengthen and you will increase the resting length of those muscles. And that's how you get rid of the Tin Man feeling. That's how you no longer feel like the Tin Man from the Wizard of Oz. So we talked about the physiology of breath. We talked about neuroplasticity with meditation and how you can move in a different way to actually decrease the pain in your body by increasing the resting length of those chronically tense muscles.
Wow. Well, thank you so much for going into a lot of detail with all of those. I think, it's a great reminder for us, even in healthcare. I mean, even for Altamash and I, those are really great reminders to realize, hey, we might even be telling our patients to stretch or when they're in physical therapy to stretch, but to realize, again, we go back to this component of being integrative and realizing how the body truly works, right? From a neuromuscular way. Personally, in the morning when I'm waking up and if I am doing a meditation practice, I choose to do pranayama, right? And that's essentially box breathing for a lot of people. And what I've come to realize is it's tough to expand the diaphragms, right? So, quote unquote, the cervical diaphragm, your actual diaphragm, these are tough to kind of expand, right? We have a lot of fascia in those areas, but over time, you can really release those tensions. And after you are able to mindfully push this air in and out and you have this control, I've come to realize my gratitude and perspective on life have come to enlargen, right? You're not solely focused on what you're doing in the next 10, 20 minutes, but you can kind of step back. And as Altamash always says, you look at from a 30,000 foot view of life and what you're going through. I know, so there is a book on my list called Breathe by James Nestor. I haven't read it yet, but I've heard it recently came out. It's a pretty good resource. Are there any other resources that you recommend that our listeners can check out if they, want to get more into breath work?
Well, I can't say any specific book. I think I teach 18 different breathing tools in my physician's program. I teach a lot of that. Box breath is one of them. That's also my military's clients' favorite breathing tool because they really like things that are very structured and organized. And doctors like to have structure and
Mhm.
visualization as well. So that's a great breathing tool. I do have 3 free videos on my website, and one of them is a breathing tool. So if anybody wants to check that out, they can go and learn and practice that.
Perfect. So you are the resource, and we'll definitely link everything that you have in there.
Yeah.
Cool.
Yeah, I don't have any book to read, but I believe, not that you shouldn't read that book, but we learn best by
Sure.
doing. And so I love to teach by
Right.
doing and letting people sense and experience. So when I teach, it's usually visual
Yeah.
in terms of something like a
But
breath.
I love the
Mhm.
fact that you go into the physiology as well, right? Because for a lot of doctors, I mean, we're evidence-based. We need the data. We need to understand how it's working before we do anything, right? So I think that's a huge component. And I think everything that you said is vital. I want to transition to life coaching because I mean, this is something I'm definitely interested
Mhm.
in the near future of getting. What is it, one? And then two, how has it added benefit to your practice in comparison to kind of yoga, meditation, breath work, movement?
Yeah, so for me, I've been it's probably in this space of stress management expertise and personal transformation and education for about 10 years now.
Okay.
And it started with learning how to regulate my own physiology, like we talked about with the autonomic nervous system. But I did feel that there was some more that I needed, that even though I could feel calmer, more grounded, and shift how I was feeling, there was still work to be done with respect to thoughts that come up. And I heard about life coaching and I decided to join a group that was specifically for physicians. And it was incredibly transformative when I learned about how to work with my own thoughts and how powerful they were. And that's why I went on to study, to become a certified life coach. So, to answer your question, what is life coaching? What is it? And people get it confused with therapy. So, I like to think of it as therapy is really learning about processing your experiences and bringing you to that back to who you are. And life coaching is you're already there, but you need to take a step forward and achieve your goals, right? So they are both very, very important, and they have very different reasons why somebody would seek out both of their areas of expertise. And I like to also think of it like a mental health care professional is like a physical therapist, where they're getting you back to baseline, right? And the life coach is like the personal trainer that's taking you forward. So since you're both in athletics, you got to think of it that way. And that has been a really good analogy for some people. What life coaching teaches us is that we think most of our problems, most of our feelings and our emotions come from our circumstances. This job is horrible. That's why I'm so sad, right? But someone else might look at that job and think it's amazing,
Mhm.
right? So what we come to understand is the job is neutral. Even though it's hard to say that, the job could be neutral, but it's our thought about the job that's making us feel sad and angry and disgruntled and hurt and upset and so on. And so we spend time really understanding how to separate fact from thought, because our brain is offering us lots of thoughts all day long, and thoughts determine how we feel and what our emotions are. It's not the thing, it's not the circumstance. It's our thought about the circumstance that determines how we feel and determines our emotions. And they determine how we show up, our actions, our inactions, which ultimately determine the results we create in our life. So when you start to recognize when you're having a thought, is that really true?
Mm.
Is it just words my brain's telling me? I can choose to believe that or not. And what is the circumstance? What isn't really changing? What in a court of law would be a fact? Job is a fact. What I'm thinking about that job, not a fact. Because you love that job on day one and you hate that job on day 201. Same job, right? So we start to really, really work with, when is our brain talking to us? What is it saying? What's not true? What is true? And then when we start to recognize that, we can actually decide what we want to think about something. And then we can create what feeling and emotion we want to have. And then we can determine how we show up
Mhm.
and the results we want in our life. So it's really an aha moment when you start to be able to differentiate between fact and thought. And that was just this huge shift for me.
Absolutely. That's amazing. And likewise for me, when I started meditating, I think again I gained a deeper perspective in terms of this greater outlook, in terms of that mentality shift and what matters and what's important and the attitude and the gratitude, and taking those two things and really running away with it and planting those seeds almost into every single thing in your life, right? And then you see those trees blossom, those flowers blossom, and you start to realize what a wonderful life you actually have, and you start to look at things like envy from a different light. But to talk about sad jobs is actually a perfect transition. Currently,
Mhm.
due to COVID, we have this new era right now called the Great Resignation, and
Yeah.
so many people,
Oh,
right,
yeah.
are leaving their jobs, and 20% of the healthcare workforce
Mhm.
is now gone. What are your thoughts on kind of what's going on and what people need to think about, especially those leaving and trying to find different opportunities?
Yeah. So a lot of these people are my clients.
Yeah.
A lot of them are my physician
Hmm.
clients, and whether they're taking my courses, whether they're private coaching with me. And what I like to always start with is, let's make sure that you're not running away from something, but that you're moving towards something else. Let me say that again. Let's make sure you're not running away from something, but you're moving towards something else. And so, several of my physician clients, after they learn how to feel better all by themselves, independent of this broken healthcare system that we're all living in, they don't leave their jobs because they find joy again in medicine. And it wasn't, leaving the job wasn't the problem. Even though the job didn't change, they were able to find joy in practicing medicine again, which is why they filled out that medical school application to begin with,
Yeah.
right? So we have to be really careful, and try and poke holes in what's going on. Does somebody really want to leave medicine because it's just not right for them anymore and they really want to pursue a different career? Or are they running away because that same person that needs to heal, that needs the education to feel better all by themselves, is not going to change when they go to that next job or the next thing? So that's really what I like to work with first, and really try and figure out what's going on.
Yeah. And I think a lot of people out there may not have found their calling or passion, right? And I think this is an opportunity for them, as you said, to move on to something else. I know you've had a similar
Mhm.
story when you were actually thinking about getting your yoga certification and clicking that pay button. Take us through that story. I think it's
Oh,
pretty
yeah.
cool if you can.
Sure. Well, I had to decide, first of all, my medical practice, I had been unhappy for several years. And I was actually working with a coach, who was a physician herself, who went through residency, started practice, was very unhappy, got a corporate job, didn't really love it. And lots of other doctors were talking to her and saying, "Hey, could you help me find some non clinical work?" And she got so busy that she started her own business, helping physicians find non clinical work. So I started working with her, trying to figure out if I should add something to my existing job, or if I should leave my existing job, or what should I do with my life. And, I was working with her for a while. And she kept saying to me, you can review medical records, and you could, work for an insurance company, and you can do expert testimony. And she gave me all these things, and none of them were really hitting me. Wasn't making my heart
Mhm.
sing, to get up and do any of those things. If you're doing those things and you love it, great. But for me, it wasn't anything I wanted to do. And I had to decide, you know, uh, do I want to stay in medicine? You know, do I want to do something else? And while I was trying to decide, because the practice I was working in lost a hospital contract, it put 5 extra doctors in the system that they didn't need. I was working part-time at the time. I was job sharing so I could take care of my kids. And so the non-partnered contracts were not renewed. So I had to make a decision. Do I do a lateral move and get another job in radiology, or do I do something else? And that was the fork in the road for me. They actually did me a favor because I really was very unhappy for many reasons we don't need to get into right now. But I said, you know what? There are lots of radiologists out there. And even though, I was very, very good at my job and the cardiothoracic surgeons were crying in my office, no joke, like, don't leave. The breast surgeons were like, we don't want anyone else to do our needle looks. But I said, you know what? I need to fill a gap that no one else is filling right now. Because if I'm feeling this way, other people are feeling this way. And so I learned about the field of yoga therapy, like I had said, and I found a program that I really wanted to study. And it was like all this money, and I had this money drama. like, do I put all this money up to do this thing? Like, where am I going? In medicine, we know we do 4 years of college, 4 years of med school, 1 year of internship. It's very structured. I knew exactly point A, point B, point C. There was nothing, and there was nobody but me. I was just totally trailblazing. So this application sat on my computer for days and days, and I just couldn't click send. And my husband was sitting next to me on his computer, and he's just like, just click send. And I couldn't do it. But finally I did it, and then I was feeling guilty about it. And then I got this check in the mail. And it was a check for just a little bit more than the amount it was going to cost me to get the certification. And it turns out that way back when I was a resident, one hospital took over our hospital, and in the transition, somebody messed up the amount of taxes that were coming out of my paycheck. And decades later, I had all this money coming to me in the form of a check. So I looked at it and I said, oh my gosh, the universe is handing me this and saying, you have to do this. Like, why would I get this check all these years later that's just about the same amount that it's going to cost me to do this training? So if that's the story you're talking about, it's just, pretty amazing.
It truly is amazing. And, I think that, so far we're coming up on an hour here, and we've really gotten the sense that you mentioned when it came to your diagnosis, you were the one to make that diagnosis, right? Despite having seen lots of professionals, and I think that all of us are somewhat privileged, not somewhat, we are privileged that we have access to amazing colleagues who will get you the treatment. And so you probably had that, but you ultimately came to this diagnosis. You are clearly a person with a tremendous amount of intrinsic motivation, right? Who was able to pull the trigger, if you will, to be able to take that step out of medicine, like Darsh was talking about. You also mentioned that a lot of your clients are the colleagues who are part of the 20% who are leaving. And, I'm wondering what some of those conversations are like, because at the outset you talked about, look, being a physician is still incredibly meaningful. And for a lot of people it is, right? And maybe people are kind of on the fence and they're like, hey, this, I want to do this, but hey, EMR, right? Previous episode with Dr. Peter Valenzuela, it's the bane of my existence, right? Insurance companies, God, are they miserable? Those kinds of issues are really contributing to it. But like the patient care, I love that, but I got to go over these hurdles. And I could do this. I could do what you're doing, Dr. Tiger. But I don't know. I'm not really sure. I'm on the fence. Could you walk us through what a discussion might look like when you're having with your colleague to help them identify what it is that they truly want?
Well, if they come to me, they're coming to me for education, to learn how to take control of their physiology, and they're coming to me for mind management through life coaching. So I really let it unfold, right? I'm not there to tell anyone what to do, but if they're coming to me, they're in that in between of, let me see if I can help myself first, So I always say, the job isn't going anywhere. Help yourself. Get grounded, get clear, make decisions from a point of abundance, not scarcity. And if you still want to leave, well, then you have your answer. So I think that even if it's not even just really about the job completely, but what we know is that the chronic stress response is responsible for so many of the chronic diseases in our country, in the world, right? Diabetes, heart disease, stroke, cancer progression and growth. It's even shortening our telomeres prematurely, right? It's decreasing our longevity. So I always like to let physicians know that no matter what happens, you're taking care of yourself, and this education isn't going to be for nothing. And it really gets them interested in taking care of themselves when they look at it from that perspective. I haven't had a single physician completely leave their practice yet. And I feel like part of my job is to help physicians find joy in medicine again. I'm not saying that nobody will ever leave, but I like to believe first, let's heal the healer, right? Let's bring that, as you say, health back to healthcare. And, you know, we have to heal healthcare so healthcare can heal. And I think that is the very, very first step, because you have to go back to your why. Why did you even start this journey? Do you want to give all of that up? And most of the time it's no. So I think that you can be calm in the chaos and you can find joy in medicine again, independent of the EMR and independent of the bureaucracy and all the other stuff that's going on. But if you really get to that amazing place and you feel like you are your best self and you want to step out, that's okay too.
I love that you talked about healing the healers, right? I think back to Dr. Ni-Cheng Liang, who came and also brought up, this concept that we have to do. I'm wondering though, if we don't have to, if there's a future where we don't have to. And I think that one way that could be addressed is if at the start, right, at the level of the younger generation, I put myself in that category. Darsh and I are still trainees, where they don't have to go through some of the things that you might have went through, right? Whether it's residency, the training hours, that kind of situation, the mistreatment, whatnot. And I think that we've just made strides, right? We've got work hour restrictions, 80 hours. Everybody knows not everybody follows that, but still, that's a different discussion. ACGME has really made a tremendous push for wellness, right? And whatever that means. And that's an important concept. But at the same time, I think that culture of medicine, it takes a long time for that to change, right? I mean, you're one of the ways that you're doing it, you had to kind of step out of it, right? You're still there, but you had to step out of it. And you also, a few moments ago, talked about how we do so much, right? We do so much of undergrad and medical school, and then residence training, which can be anywhere from 3 years to 8 years, depending on the fellowship. And I think about this concept of that Adam Grant talked about. It's escalation of commitment, right, or commitment bias. And I think he references his own brother, who always knew wanted to be a neurosurgeon. So they kept going. Then it was the next step, and now you're 15 years in, and well, God, you can't leave now, right? Now it's the next step. And then before you know it, you really tremendously need healing before you can actually heal your patients. What are your thoughts, or what advice would you give to trainees, or maybe even medical students, or maybe even undergrads thinking about going into medicine, so the harm isn't even done and the healing isn't required later on?
Yeah, it's a great question. So my dream, while I'm still on this earth, is that the education that I'm providing now, which is essentially relieving suffering and picking up the pieces, becomes intracurricular at the very beginning so that we can prevent what's happening. Everything right now is on the back end, right? So I have medical students reaching out to me, and I am working with them. I have pre-med students reaching out to me. I have pre-med students that have taken a gap year between college and medical school because they actually know the stats of what's going on and they want to educate themselves before going to medical school. But they are few and far between. So putting this education, making it intracurricular, you can decrease the call hours, and you can, improve a lot of things going on at the level of the healthcare system and the EMR and whatever. But you still have the human that is sitting there on day one of orientation in medical school, freaking out that they're not smart enough, that everybody else is better than them, that they're not going to make it, that somebody made a mistake in choosing them and in, accepting them. That starts day one of medical school. I work with those medical students, and they're already a mess a few months in. And what we know from research is that when they studied matriculating medical students and their age matched peers, okay, they studied them. Medical students aren't coming in broken. Medical students actually have a higher quality of life, less burnout, and less depression than their age matched peers. So they're coming in at higher protoplasm, right? Our med students are coming in amazing, but 50% of them are getting burned out. And 10% of them have suicidal ideation, and 30% of them are depressed. So we know that starting at medical school, in medical school, we are taking these amazing humans, and the process is already breaking them down. So I believe that we need to have this education intracurricular at the very beginning, starting with day one of orientation. Now, how can I do that? I've tried to talk to deans. I've had conversations with deans, and I am working on it. But I believe that that's the answer.
No, I love that. And, it sounds like a 3-hour mandatory module on burnout isn't going to take care of that, right? I say that tongue in cheek, but I really love that. I mean, again, we talk about the concept of preventative medicine that, sometimes doesn't really exist, right? I mean, it's just something this made up thing. But what you're talking about now, I mean, it all has to start about earlier intervention, right? And risk stratification. And unfortunately, going into the healthcare industry, it's kind of a risk, right, for this, much earlier than other professions, I think. We wanted to ask you what you would tell the younger Robyn, right? Knowing this story, knowing all the information, right, from the physiological level, the mechanistic explanations, but also that 50,000 foot view that we talked about. I'm actually curious what you would tell the Robyn in 3rd grade when you saw that skeleton come out.
Yeah, well, I still would tell her to go for it. But I would want her to make sure that she got the proper education. So she had the toolbox, that she was equipped so that when she stepped into this journey, she was armored with what she needed. And I was not. And every other medical student that starts, they're not either. So I wouldn't say don't do it, but I feel that there needs to be this education. That is this missing, gaping hole in this whole process.
Yeah, I couldn't agree more. I mean, we're talking about education in medical school. I think there's a need even for education for these things in grade school, starting us even younger. I know a lot of other countries look at that. I think, man, I can't remember if it's China or Japan, but they actually just teach social and emotional intelligence up until they're about in like 4th or 5th grade. And that's when they really start, their basic sciences, math and all that. So it's interesting, and there's a lot of wisdom that you're saying. And, there's a lot of wisdom through your experiences and journey. And, Ultimash and I are, lucky to even have you on here to kind of listen to this and soak it in. I do want to ask you, you're known as the Stress-Free MD. What does it mean to be stress-free now that we've kind of talked about this?
Yeah, well, the thing is, nobody walks around 24/7 without stress. I mean, that would mean we'd have no sympathetic component to our physiology. We're just kind of ragdolls all the time. But what I think it means is you do have the tools and you've built your toolbox for whatever's coming your way. So you know how to take care of yourself. You know how to feel better. You know how to be the healthiest and happiest version of yourself. That's what it means.
I like that. Yeah. Something that we're striving for every day, and you can just tell by your composure and demeanor here, making this podcast episode stress-free. So absolutely loving it. One thing I did want to ask too was, again, I'm going to reference my burnout from last year is I didn't really reach out for help, to family, to my wife, to friends, when I probably should have, just to kind of release some of that pressure, to vent a little bit. How can we gain comfortability when we are feeling stress and burnout to reach out to our loved ones, to reach out to those who probably have a way of securing our messaging with them?
Well, I think it's important to normalize what's happening. I don't know if you've seen Medscape's 2022 Physician Burnout and Depression report that just came out. But we pretty much have 4 out of 5 physicians burned out at this point. So if we've got 1 million docs in the country, we have 800,000 burnout physicians. Okay. So a lot of people think they're alone because also egos do not allow us. Guilt does not allow us. We feel we've been through all this. Who am I to say I have a
Yeah.
problem? Look at me. I'm so lucky. Like I can't complain about anything. Right. So we need to normalize it. Normalizing it doesn't mean it's okay. Normalizing it doesn't mean it's fine. But when physicians recognize that 4 out of 5 of us are feeling the same way, it can make you feel not alone. And you feel that this community is with you. So for me, I didn't know that there was anybody else. And I didn't have a label, I didn't have anything, right? So I think that the more we talk about it, the more that people like me are vulnerable and share stories, the more that it's out there in the literature, doctors will feel more comfortable discussing it because we normalize it. And I think that's really important.
What about the flip side, right?
Mhm.
I don't know this for sure, but I suspect that, you know, you mentioned your colleagues who lost their life way too soon, and you mentioned one of your big sisters. If I think sometimes there are signs, right? Often there aren't, but sometimes there are signs. And what would you tell, you know, somebody who listens to this episode? I don't know if it'd be a good strategy to send it to somebody who might be down, right? Might be experiencing that. Just forward this. I don't think people are as receptive to that. How could someone who can register those signs with their colleagues, their residency mates and trainees and that kind of stuff, or just even in the attendinghood, are picking up on those things and know that something's off, but need help, but aren't reaching out to them like Darsha asked for. How can they communicate and open up that conversation to say, hey, this is a safe space. I'm here.
Yeah, I mean, I think just being there, I had to take a suicide awareness course for life coaching, and there are a lot of really important points in there. But recognizing when somebody isn't themselves and being there and saying, hey, I'm here for you. Do you want to talk? Can I help you? Do you want to talk to me? And there's an incredible collective of mental health care professionals that offer free calls, physician to physician, for physicians who are suffering. So in addition to a suicide hotline, there are actually mental health care professionals that are doctors that have voluntarily given their time to provide therapy sessions to doctors, and they can call this number whenever they want to call it. So I think giving resources is very helpful too, because someone might not want to open up to you, but they might be more willing to talk to a neutral individual who is specializing in this area, who's also a doctor to doctor. So that's what I would recommend. But I didn't see any signs because, again, lots of people wear a completely different armor like I did on the outside.
Absolutely. I mean, it's definitely challenging to say the least. And as you mentioned, or as I mentioned a long time ago, sometimes having not all this knowledge, of course, like I've learned so much from talking to you, but I think just being in this space and having an interest and appreciating how often it is important to step back and look at the bigger picture for the patient, but also look at the mirror and see what's going on. I still find myself sometimes, just because of the culture that we talked about, the way that we're trained, telling my wife, "Hey, the show must go on," right? And I think that this has given me some time to just reflect and some introspection as well, and that when it is appropriate, and the importance of a social network like you're talking about. You mentioned a little while ago about all the courses that you teach, right? And the 18 different courses that you mentioned that we're going to link. What's your current business or practice look like? You're teaching a lot of courses, but what else are you offering?
Yeah, so I focus on getting CME in everything I do because I feel like physicians should get paid for learning how to care for themselves. So I do have this one program, RX Inner Peace, a physician's guide for self-care, which is a really innovative, one-of-a-kind program, which incorporates everything that we talked about. It teaches the physiology aspect of things, how to really bring homeostasis to your nervous system, and also that life coaching piece. And it's self-paced. Docs are super busy, so lessons are really short, like 15 minutes or less, because everybody's really busy, right? And so that program is like the mothership program. And I also coach privately, right? So physicians, lots of them will come from that program and want to continue with me, or they just want private coaching. I have a podcast, which is the StressFreeMD podcast, where I teach short snacks of stress-free tips that can be implemented right away. I am starting to coach for my medical society. I was just asked to join the faculty of the American College of Lifestyle Medicine as the subject matter expert for stress management. So I'll be creating the content for their next board review coming up. How else do people work with me? I've been doing retreats. I present, I give talks virtually, beam me in. Didactics for residents, lectures for med students, you name it. So it's really whatever people need.
I love that. You are so incredibly busy. You're getting the message out. It's amazing that you're managing to keep your stress levels low with that. So, just hearing all that stuff, it's like, oh my God, there's so much. I'm getting anxious. But so something that I need to work on. Darsh tells me, when I tell him I don't have 10 minutes to meditate, he tells me I need 20 minutes to meditate. That's what I need to do. So one step at a time, we'll work on it.
Yeah.
So all those things you mentioned, where can our listeners find you? How do they access all that stuff that you mentioned?
Yeah, they can find me through my website, StressFreeMD.net. And wherever you are on social media, I'm pretty much there. LinkedIn, Instagram, Facebook, Twitter. You can find me in all those places, wherever your favorite social media platform. I think I found you guys on Instagram. Yeah, I'm really accessible. If you want to hop on a free call, I'm happy to, help you get started on your stress-free journey.
Perfect. Well, this has been awesome, Dr. Tiger. I really want to say thank you from the bottom of my heart for, showing up here, keeping it, again, stress-free, your demeanor, your composure. I mean, I could really feel it through the screen even. It's been inspiring and really motivating for me to even, just hone in on my practice a little bit more and become more grateful and to have those conversations with myself, right? I think we can be our biggest enemies, but also our biggest friends. And there's no one else you kind of go through this life with other than yourself, day in and day out. And I truly believe in synchronicity, right? Like your yoga story and the check. And today is the Chinese New Year, and it is the year of the tiger. So what is what is next for you?
Oh, what's next for me? Well, I'd like to be able to work at a national level. And so I heard Dr. Vivek Murthy, our Surgeon General, talk about how he's focusing on a national agenda for physician well-being. I had the privilege of meeting with his chief of staff last month, and I'm hoping to continue the conversations to help at a more national level. So Dr. Murthy, if you're listening, or Max, your chief of staff, I am here to assist. And other than that, I'm just saying yes to as many projects and collaborations as I can to coach and help as many on the medical journey that I can.
Love it. Yeah, I know Ultimash and I can't wait to get this episode out there for everyone to listen to. Last question for you. We ask all our guests is, how do we put the health back in healthcare?
Mm-hmm. So I think it starts with the human, right? And recognizing that we are humans, right? And so we as physicians are really the gatekeepers of health. We need to set the example. The most recent stats that came out through Medscape said less than 1/3 of all physicians care for themselves on a regular basis. So we have some work to do. So I think the answer to that is first from the top down, not that we're better than patients, but they expect us to set the example. We need to care for ourselves first. And that is how to put the health back in healthcare. When we set the example, we can teach our patients what we've learned. My CME provider, UNC, loves that what I teach physicians they are now teaching their patients. So when you learn how to do box breath, you teach your patients how to do box breath, for example. So we put the health back in healthcare by taking care of ourselves first and then sharing it with everyone else.
Love it. Thanks so much, Dr. Robyn.
Thanks, Robyn.
Thank you. Thank you so much.
And there you have it, an amazing episode with Dr. Robyn Tiger, the self-care doctor and the stress-free MD. Now, as you guys know, mental health issues are at an all-time high right now. So if you feel like this episode will benefit someone you know, please share it with them. I think the information that Dr. Tiger presents in this episode is super valuable, and I think we can all learn how to become a little bit more stress-free. And if you are enjoying this podcast, please go ahead and leave a 5-star review on Apple or Spotify or wherever else you listen to this podcast. Everything in this podcast is for educational purposes only. It does not constitute the practice of medicine, and we are not providing medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues. See you at the next episode.